So the CDC ended the 5-day COVID isolation guidance today, March 1st, 2024, where they are no longer recommending Americans stay home from work or school for 5 days after testing positive for COVID 19. And I personally am shocked by this because we were told back in February that we would have the opportunity to provide feedback on this proposed recommendation in April prior to it being enacted. Yet they unilaterally pushed the changed guidelines, stating that the simplified guidance recommends that even if they don't know what virus is causing the illness, people should stay home when they are sick and symptomatic and resume normal activities if their symptoms have been improving and they are fever-free for at least 24 hours without any medication. So instead of investing in things like developing a 3-in-1 test, where you can simultaneously test for COVID, flu A, flu B, and RSV, where you can then use the results of this to get appropriate treatment with Tamiflu for the flu or Paxlovid for COVID. The CDC is saying F all. And the nuance will be in this part right here, and versus or. In what I had originally seen, it was saying that improving symptoms or fever-free for at least 24 hours. So I think this is actually a typo in this article, where the CDC is saying that they still believe it's an important health threat, but is no longer the emergency that it once was. But health advocates are rightfully slamming the CDC in their Friday announcement as a move catering to big business that goes against medical science, because COVID's symptom duration has not changed at all. We should still be isolating for 10 days according to science, with an additional 5 days of masking. But instead, now we're limiting it to 1 day, where the burden is now placed on the individual, especially essential workers, where they're going to have to negotiate sick time to recover and to try to not infect other people, where this policy is 100% going to promote the spread of COVID, resulting in continued mutations and higher rates of transmission over the next year, which is going to change our COVID landscape once more because of this policy.